So what's up? Today we're going to talk about the first pass metabolism or first pass effect. So what's first pass effect or metabolism? Suppose this is your mouth and this is your esophagus, and here we came in the stomach, and this is intestine, and as a whole this is your GI tract, right? Now, when you take a drug orally, the toxic things and the drugs, everything is carried through the portal circulation into the liver, and finally from the liver, the drugs get into the systemic circulation. So this is a symbolic of your systemic circulation, right? So you take a drug, suppose 800 milligrams. Now, the drug passes through this, and then the drug, through the portal circulation, it goes into the liver. From the liver, it gets metabolized, and after the drug gets metabolized, the remaining drug goes into the systemic circulation. And suppose only 400 milligrams of the drug taken went into the systemic circulation, right? So the question is, where did this 400 milligrams of the drug go? So the 400 milligrams of the drug got metabolized in the liver, right? And only 400 milligrams of the drug went into the systemic circulation. So this is the first pass metabolism. The first metabolism, the drug goes after you take a drug orally. That's first pass metabolism. And the first pass effect is that only some fraction of the drug goes into the systemic circulation when you take the drug orally, and that's first pass effect. First pass effect and metabolism that comes together. They're more or less the same thing. So first pass effect is the effect when you take it orally and some of the drug gets metabolized in the liver, and only some fraction of the drug goes into the systemic circulation. For example, you never take a drug lidocaine orally. You know why? Because the lidocaine is very much rapidly metabolized in the liver. So if you take the drug orally, almost all the drug gets metabolized in the liver, and you'll get very little and negligible amount of drug in the systemic circulation. So to prevent that, we give this drug IV. In the same way, there's another drug called nitroglycerin. This is a drug you give in acute angina attack. So this drug we give sublingually. So when you give this drug sublingually, what happens is in the sublingual region there is so much vascularity. So this drug directly gets absorbed in the blood vessels. So very less amount of the drug goes via the GI tract, and very little amount of the drug goes to first pass effect. So there's negligible first pass effect in the nitroglycerin when you give the sublingual route. So these drugs, to prevent the first pass effect, we give by IV, and this drug sublingually. So this is all about first pass metabolism effect. So this much for today. We'll meet in next video. Thanks.